welcome back to this episode of this Healthy Life podcast. I'm very excited for my guest today. I have Chrissy Powers, and she is a licensed therapist, coach, and writer, and she specializes in helping humans embody their true self and also helps us people with ketamine-assisted therapy. So this is a topic that you might be hearing more and more about today, and so we have an expert here to share her wisdom and how this is helping a lot of people out there. So Chrissy, welcome. Very excited to have you on today and have this topic.
Thank you. Thanks so much for having me.
Amazing. So I'd love for you to start just with a quick intro, sharing a little bit about yourself, your practice, and how you got into this space.
Yeah. So I became a therapist in 2010, and I initially wanted to become a therapist because I wanted to work with eating disorders, having just recovered from one myself in my 20s. It really helped me to see that sometimes the therapists that had gone through the thing you were struggling with were the best healers, in my opinion. So I was like, oh, I think I should do this. And so I did. And it became quickly very true that I was supposed to be a therapist. But the world of mental health is so big that I realized that I didn't necessarily want to stay with eating disorders and drug addiction. And there's a lot of burnout in that world. It's really, really hard to keep seeing clients like that when we see that they relapse a lot. And so I took a little time off while I was having babies, but went right back to it after and grew my practice. And I struggled with my own mental health as I was entering into motherhood, as sometimes that happens. Motherhood really exposes you to what needs to be healed within yourself. And so I had a lot of anxiety. I had a lot of panic. And I thought it was from certain situations in my life or things that naturally make us scared as mothers. But as I went into therapy, I really learned that a lot of my issues came from having a destabilized nervous system from childhood. So I started to learn more about embodiment and what that was. And I was like, wait, what is this thing about embodiment? I thought we always lived in our bodies, but really we don't. We live in our minds, we live in our thoughts, and we override our bodies a lot, especially in our Western culture. So I learned a lot about embodiment, and then embodiment led me to psychedelic somatic work. And I always tell my clients, I'm the last person that I ever thought would do this work. Because I was so scared. I was so locked up in my body. I had a lot of religious trauma growing up as a pastor's daughter. And so I was very, very much the good girl. Never drank, never did drugs. And I then end up in this world of psychedelics, and I'm like, I can't deny how much it healed me and gave me myself back. That I feel like now it's a credibility almost, to say this wasn't something I was interested in. It was something that came to me and that healed me. And now it's healing a lot of my clients.
Amazing. Awesome. So yeah, I'd love for you to touch a little bit on, you mentioned kind of like embodiment and somatic work, and how is that different from, just like a general talk therapy session? What is kind of the key differences that make it somatic therapy and make it more embodiment?
Yeah, that's a great question. Yeah. And I get a lot of people that come to me that are like, I've been in talk therapy for years and I need something more. I'm like, great. I think that talk therapy is wonderful, especially if you've never had a voice or, excuse me, my throat's.
Speaking of voice.
I think if you've never had someone to share your story with, it's so important. So it's not that we're saying talk therapy doesn't work. It does. But oftentimes when we're working with trauma lives in the body, and that has to be witnessed. That story has to be told through the body. So oftentimes I will pause my clients and say, I know you're telling me this story right now, but where do you feel it in your body? And then they're like, wait, but I just want to tell you the story. And I'm like, but we also have to feel what it feels like to be you. Let's feel that in their body. And then a lot of my clients have anxiety. Anxiety is so physiological. It's IBS. It's like a heart racing heart. And so it really crosses over to okay, but your body's speaking to you. Let's go in there and see what is your body saying? Like, what is there an age that is associated with that feeling? And oftentimes we can find pieces of this person or what they've gone through and we put it back together, but through the lens of the body and what the body's saying as well.
Yeah, absolutely. Awesome. So let's talk a little bit about nervous system dysregulation. So you mentioned, that that was a big key thing in your history and your upbringing. And I mean, I'm sure everyone on this planet is dealing with some level of nervous system dysregulation, especially in like our modern world. So what are some key signs that you can look for to kind of see and understand if that might be something that you're dealing with, or how to become aware of nervous system dysregulation in your own body?
Yeah. Yeah, especially now, I think the world we live in is naturally destabilizing. Like we are on computers all the time. We are on devices, social
Multiple
media.
screens, right? It's like you're like on your
Multiple-
computer, but you've got your phone in front of you. Like I'm guilty of it too. I'm
Yeah,
like, how many screens do I need? How many like sources of
yeah,
information to like, and no wonder like I have focus issues sometimes.
right. I think we'll probably understand this more in the future. We're already seeing studies that are coming out about Gen Z, and there's a great book written called The Anxious Generation, and how their nervous systems now were never really given a shot to begin with because they grew up with phones or iPads or whatever. And it's not about like those things are necessarily bad. It's how do we learn to live with them and adapt, and our bodies aren't used to that. Like they're not used to having that much news. Like our nervous systems are not used to taking in the amount of information we take in daily now. But a lot of times when I was speaking about nervous system dysregulation, it was the beliefs that I held and the amount of pressure that I put on myself or was sort of put on me unconsciously at a young age because of high control religion. I didn't realize that what I was carrying was too much for any child to carry. And so, even though that's my story, like anybody listening, those things in childhood that you remember are pretty significant. Those are the things that probably primed your nervous system to begin with to be a certain way. So if you're naturally anxious, like, okay, like when was that? When were you, first taught that it wasn't safe to be in your body? And you may or may not be able to find that cognitively, but your body's literally telling you there's a consciousness there. There's a primary consciousness within the body that when it's witnessed through this type of therapy, we're really able to attune to it, to say, yeah, that we can see what happened. We can see how that was so hard for you. That this is the story of what happened to you. And there's nothing like that affirmation and that validation and that emotional attunement that you can give to yourself. So nervous systems are dysregulated for many reasons. Yeah.
Yeah, and it really kind of puts you into that survival mode kind of
Mhm.
mindset, even if you don't think you're in survival mode, right? You're just like, I'm just busy. I'm like, you kind of fill that space with busyness or things to do instead of kind of like really feeling into that and
Yeah,
realizing that your nervous system is kind of a little bit haywire and not feeling safe in the world.
absolutely. I mean, I still have to check myself like monthly if I ingested too much this month of news or I didn't rest enough or I mean, particularly for women, when we learn about the cycle, I'm like, I don't know how any therapist can treat women and not know about the hormonal cycles that we go through.
Absolutely.
And there might be a week where your nervous system does not have as much of what it needs to be as stable, and you have to meet it with that stability or that
hmm
rest.
hmm Yeah, and I think it's like as a culture today too, right? It's just like push, 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 like be so like motivated and driven and results driven when all that's doing is just kind of stressing out your body even more, pushing you further into a more depleted state and further dysregulating your nervous system, which then leads to health issues and chronic health issues. And like you said, anxiety. And that's kind of just like the tip of the iceberg, right? Like you end up with like autoimmune conditions and all those other things that come from not taking care of yourself that I know personally from my own journey, like I ended up
Yeah,
getting Lyme disease, but I mean, that wasn't just the thing that set me over the
yeah,
edge. I learned more about this and kind of look back, it was years of running myself into the ground and not taking care of myself and always being in kind of this like anxious hyper state, not
yeah,
regulating my nervous system that just kind of set me up to really go down when I got that tick bite.
yeah,
So it's a long path of things that now I'm aware of and try to be better about. But so many people don't have that awareness until you hit that kind of rock bottom state.
Mm. Yeah. Yeah. I totally resonate. I got
Yeah.
Hashimoto's at age 16, and now I'm like, I wish that I could go back and
Yeah.
just would have gotten into therapy a lot sooner.
Hindsight is 2020, right? So let's talk a little bit about ketamine. So how did you get into this space? So especially I'm so curious about that from, like you mentioned, kind of going from your upbringing of being in this strict, like religious kind of family to working with psychedelics and working with people and helping them heal themselves. So I'd love for you to share a little insight of what drew you to it and how you got in that space.
Yeah. So I have to give my parents credit for they always normalized mental health. My dad was very open about his depression
Mm-hmm.
and how it ran in our family. And then I feel like I took that and I went further with it. I was like, well, if this runs in our family, I'm going to figure out why. I'm going to figure out the root of this trauma, and I'm going to pull it out, and I'm going to not letting this go on. I'm a cycle breaker. So, but I'm so thankful for parents that made it safe to go there and ask those questions. And I can remember telling my parents, I'm going to do this thing. And they were like, okay, well, we're going to be praying for you. And I'm like, thank you so much. Like, and so I kind of felt safe. I did it with a therapist at a clinic in La Jolla where I live. And so there was like a nurse practitioner there. There's someone that, screens you first for eligibility. And then there's a therapist with you the whole time. So I really wanted to just understand it for myself, so that I could either refer it to clients that have treatment resistant depression. And what I found was just so much relief and freedom from one session. And this therapist didn't even have a relationship with me. They didn't know, they were just watching me. So I felt safe. And then it was like after that, I knew I had to, do some more research. And then eventually I was like, I found the right person, the right mentor in this world that does this work in such a beautiful way where you're not just watching the person, you're really with them in it. And it's like the type of therapy that makes me feel like, oh, this was always the type of therapist I was supposed to be. It almost feels like you're a doula in some sense, like it's a birthing experience. Like I'm like in there with you. Like if you need to throw up, I have the throw up bin. Like, you need to get this out of your body. We
Mm-hmm.
will. And I won't leave your side. And so was such a beautiful journey of me trusting my body and coming back to my body. And I really only needed one session for me to understand how powerful it was for me. Um, and so it's not until really the last 2 years that I've been all in on all of my trainings and certifications in this and trying to just learn more and more, because it is a pretty big world and there's lots of different medicines. Right now, ketamine and cannabis are the only legal ones, unless you live in, like, I think Portland, Oregon, Colorado. They have destigmatized psilocybin. Yeah. So, and I think MDMA is one that's like hopefully going to be um, legal soon. So I'm really excited for the future of what is possible with these medicines. But right now, I'm really focusing on the ones that are obviously legal that like I can feel confident with. So,
Yeah, absolutely. Great.
yeah.
So can you walk us through kind of like what to expect on one of these healing sessions, like using ketamine? Like what is the experience like? Like how long does it last and what
Mhm.
can you expect to kind of go through during one?
Yeah, ketamine is a wonderful relational medicine. It's actually been used as an anesthetic for children for years and also on the battlefields. Like it's like very easy to ingest. And it's a disassociative medicine. So I'll often tell my clients it feels as if you're in a dreamlike state. You're like disassociated, but you're still very much in your body. And oftentimes I'll have clients say it feels sort of like a very warm hug or love kind of encompassing them. So it's different than cannabis, which sort of strips you bare and shows you what is there, which can be terrifying. Um, and ketamine is very different in the sense that it's very relational, very loving, but will also show you what's there. It will also take you to places or take you to disassociative places where we look at as, oh, that's where you had to go to get safe. There are parts of you there that you're trying to get back. And a lot of times clients can't even really speak in the beginning because they're just so in it and there's so much going on. Like they're seeing, you're not hallucinating, you're just, it's like a dream. Like there's images, there's thoughts, and there's things that maybe don't make sense in the moment, but then you make sense afterwards. I also love ketamine because it's really only you're altered for like an hour, hour and a half, 2 hours at the most. So for clients, it's so helpful because you can not be out for 6 hours. Like you can go back to your life. You can't really drive and operate machinery that day, but you can still go home to your family. Like you're not going to be out for 6 hours. And ketamine also heals the brain. It works to address like there's neurons, neural pathways, and dendrites that are attached to your neurons, and stress, depression, anxiety, all those things that disembody us really hurt our brain. They wither the dendrites that are attached to our neurons. And so what ketamine does immediately is it thickens those dendrites and it opens up neural pathways so that you can have new thoughts and they feel real. They feel true. I had one client say in a session, "Oh my gosh, I feel like I love myself. This must be what self-love feels like. And this is the first time I've ever felt it. And I believe it." And that believing part was so important because it was real for her and it stays with you. You don't forget. So that's a little bit about ketamine, like how it works and it like opens your mind to even 2 weeks after. It's like it's like the glasses are the bad glasses are off and the new ones are on that just have a lot better vision and it feels like, okay, like I feel better. And so a lot of people are doing ketamine that have had resistant treatment resistant depression or other issues like OCD and anxiety. Because when you do a series of ketamine, it builds up in your spinal cord, which crosses the blood brain barrier, and it helps you to stay feeling better longer.
Okay. Yeah, that was going to be my next question. So how often do you usually recommend, someone does it? Is it something that you do like a series of 3 or 4 in a row and then you kind of sit with it and see how that's
Yeah.
feeling in your body? Or is it something that you want to continue pretty regularly until you feel like you've gotten to the
Mhm.
place that you feel good at?
It really depends on the person. It depends on the person, what they're presenting with, what their support system looks like. Like a lot of people, like I said, with the treatment resistance depression, they will be doing one like every week so that they can get to a place or a baseline that's like higher. Most of my clients are pretty high functioning. So they will do one maybe once a month or once every 2 months, and then we'll integrate for a while. And then when we're ready or when they feel ready, they'll come back and do another one. So it's really like in therapeutic relationship, what they feel like is needed based off what they're working on.
Mm-hmm. And then are there certain conditions that it works really well for versus certain conditions that maybe this isn't the right fit or not something that can maybe kind of help you? Or is it generally pretty good for anyone that's dealing with some sort of like mental health situation going on or nervous system regulation?
Yeah, the only contraindicators really are if you've had a psychotic episode in the past, or if you have, I think it's hypertension. Um, so that's why we have everybody get cleared medically first, to know that they're safe to do this. And so that's really the only reason why you wouldn't, unless you're really not wanting to heal or to look at those places in your mind that might be scary. But most of the people at that point are like, hey, nothing's scarier than the
And then
reality.
since it's kind of treated as like a therapy session, you're there as well too. So if like things do come up, they will always kind of feel supported and be able to kind of work through that in the moment as well, right? So is it more kind of like are you kind of on your own journey and you're just there if you need them, or are you kind of acting as a therapy session while you're doing it?
Yeah, I'm really utilizing it as a therapy session. There's different kind of dosing. So like when my clients take a higher dose, I like give them more time to process. And then as they're coming out of it, it's kind of like a hill. As they're coming on the other side, then I sort of step in and I'm like, what are you noticing in your body? What's happening? And that's the great thing of doing it with a provider, because we understand the body. We know, like I had a client that was just like tense the whole time and her arm was like like someone was going to hit her. And so we were really working with like that feeling of what was happening to her in her body because it was telling us a story. So sometimes I will give the client time to really process on their own. And then when the dosing gets a little lighter, then I come in with the relational piece of like, tell me what that was like for you. I can see it. This was so hard. I believe you. And also, yeah, like you can do something about it now. What do
Mm-hmm.
you want to do?
Yeah. It just
Yeah.
opens up things that probably like weren't coming up without any sort of assistance, right? So things that you can kind of really deep dive into what might be holding you back or, causing some of your symptoms for sure.
Yeah.
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 Oh,
So it's
awesome.
working really well with my clients that have anxiety.
Mm-hmm.
Most of them are the ones that are the most scared to try. Like you are the one that needs it the most because you feel what it's like to have a nervous system that is soft and calm. And
Yeah.
they get that like immediately. They're like, oh,
Yeah.
I will never be scared of this again. Like, so,
And it's such a
um,
weird feeling, right? When you're so
yeah,
used to being in that anxious state to be like,
to be
so
calm.
relaxed. You're just like, this feels weird. Like, where's my energy? Where's my my anxious energy
Yeah.
that's driving my energy and drive during the day? It's like you really have to kind of recognize that. Like, is it anxiety or is it energy that's propelling you to be
Yeah.
nonstop in your daily life? So I think that's a interesting
100%.
takeaway for sure. Awesome. And then how do you administer it? Is it an IV or is it an oral form or how do you administer it to your patients?
So I use a medical provider for therapists. It's called Journey Clinical. So all my clients get screened by them and then prescribed medicine by them, and then they get the medicine, and it's in a lozenge form, so it's oral. So I just help my clients take it and swish it around. You swish it for like about 10 minutes and then spit it out. And so I don't really touch the medicine, which is great. Like, and that's like the easiest form of taking it that I have found. But yeah, there's lots of other ways that people do it. I think there's like a nasal spray, there's intramuscular or an IV, which the IV, I think people that go to ketamine clinics for the IV are really, really, really treatment resistant, and they're needing that higher dose to get to a place of I can live, I can thrive,
Yeah.
I can walk out of here, and yeah.
And I've heard a lot of success stories too using ketamine for pain as well. So people that have like severe chronic painful conditions have been getting a lot of relief from doing the IV format of it as well. So not only is it sound helpful like it's for your mental health, also lots of physical health and kind of like rebuilding your brain and like you mentioned really healing your brain with so many of these conditions that get affected by that. So
Yeah.
it
Yeah,
sounds
I'm so
like
glad you mentioned that.
all
Yeah.
around amazing medication that we should be using more of, right?
Yeah, I mean, I know there's, like, lots in the
A
news about.
stigma.
Yeah,
Hmm.
there's a stigma for sure.
There's a
Um,
stigma about everything, right? I mean, even like cannabis, which has now
yeah,
thankfully finally become more available to people. And I think it's such an amazing, helpful medicine as well. It helps me so much on my own personal like Lyme journeys and things. So I think that's finally getting destigmatized and people are realizing like it is a beneficial plant. And I think the same thing is going to happen with a lot of these psychedelics as well. Like psilocybin, we're already starting to see that, ketamine too. So hopefully more of that in our future and really using all these medications for their benefits instead of the bad
yeah,
things we hear about them.
right. I mean, and the bad things we hear are also for a good reason because we want people to stay safe, which is why you should be doing it in a medical therapeutic setting, not on your own. It's not like going to a rave and taking ecstasy or taking ketamine. It's from a compound pharmacy. It's pure. You're safe and held in the right environment. So yeah, we should always lean with caution when we're doing any of this work, which is why it's so important to do it with people that are trained and specializing in it.
Yep, and getting the right stuff and from the right
Yeah.
sources and things. Absolutely. Yeah, absolutely. And then so are there any things that could go wrong like during a ketamine session? Are there things that you need to be wary of? Like you talked about like the contraindications. So as long as you don't have any of those things kind of preventing you from doing it, is there anything that people might experience afterwards or during that might make them uncomfortable or anything that they should be looking out for or aware of?
Yeah, the only thing I could think of is just the stories that come out like that are really hard to process and integrate, which is why, once again, you should be in a therapeutic relationship. I don't know if you've seen or heard of the book The Tell, Amy Griffin. It's her memoir of uncovering some pretty severe childhood abuse through MDMA. And Oprah just put it on her book club, which is amazing. But you really get to see what it's like for her to uncover this, and why people were like, why did you do this? Like, why did you want to uncover this? And she was like, because it was killing me without me knowing it. Like, she was lost for years. She was locked up in her body. She didn't live. She was perfectionistic. She was driving herself into the ground. And then now that she uncovered this abuse, she was able to heal from it. So, but was it easy? And was it? Yeah, it was not easy. It was hard for her to heal from this. It took years of integration and other medicine sessions with her therapist to really feel stable. But she says she would never regret it. Like, she got her life back. So the only thing that would be like hard was knowing, like, you're going to go into this and you're going to see things that are hard, possibly, um, that you are going to encounter, or yeah, can encounter. And that does destabilize you a little bit in the beginning, and it does shift relationships. It does. The way you show up in your life is going to be different, which impacts the relationships in your life. Hopefully it's for the better. But even when we change for the better, people don't necessarily like that.
Yeah. They're
And they
used
don't
to you a certain way, right? And like relating
that.
with you a certain way. Absolutely. Yeah, I noticed that a lot, even when I went through like my own Lyme journey, there's like a lot of friendships that I lost over the years that were like close friends, but then I just realized like how toxic those relationships were and how I used to be a different person. And once I did a lot of like healing work, because it wasn't just like physical healing with Lyme, like you have to heal like mentally and emotionally and spiritually, like on all levels to like actually truly get better. And yeah, then you just like kind of start showing up differently or have better boundaries, and people are just like, hey, this isn't the same anymore. I don't like you anymore. And I'm like,
Yeah,
well, that's okay.
yeah,
I'll make
yeah.
new friends.
You're like, but I like me.
Yeah, I like my
So I
version
guess I'm
better.
okay. Yeah,
Absolutely.
100%.
Yeah. So I'd love for you to share, if you can, like one or two like amazing kind of like breakthrough or success stories you've had in your practice using ketamine, and just something that like really shaped someone's life for the better and took them to the next level.
Yeah, a couple stories come to mind. One is a client I worked with for a while and had a really severe fear of death, and sort of manifested in like being like hypochondriac, like, worrying about everything. And so we did this ketamine session, and she literally saw what death was. And she was like, and I asked her, what does it look like? And she's like, it's like the guy from Scream. And I said, oh yeah, that's like so scary. And I was like, but wasn't he in a costume? And she was like, oh my gosh, yeah, this is a costume. And I was like, well, what do you want to do with the costume? And she was like, I'm gonna fold it up and I'm gonna bury it. And I was like, you do that. And so in the session, she like pictured herself, like she could see clearly death was a costume. It wasn't real. Like, it wasn't coming for
Mhm.
her. Like, and so she like folded it up and put it away and like put it somewhere, and then sort of decomposed of it. And so she
Mhm.
said ever since then, it's never been the same. It's never haunted her
Wow.
in the same way.
That's amazing. That's
Yeah.
awesome. Yeah. Yeah, I'm sure there's just like so many stories you have just,
Oh
working with people and transformations. And so like it sounds like it happens pretty quick too, right? I mean, you mentioned like even after one session you have a tremendous breakthrough. Like generally if someone wants to kind of explore this avenue of using, ketamine or other psychedelics, like does the transformation and kind of like healing happen a lot faster than say like talk therapy, which I guess sometimes with talk therapy maybe you don't ever kind of get to the healing point, right? Because you're not really diving deep into what's going on in the body. So, in your experience, is it kind of a faster track, if you will, to heal with the ketamine therapy? Okay, yeah.
Yeah, 100%. It's a faster track. That being said, we try not to have expectations because each person is different. And the first session, I've had clients have amazing first sessions like the one I just shared with you. And I've had clients that just are disassociated the whole time and they don't know what they just did. And we're like, that's okay. Like, we're going to keep exploring this and what it's like to be you and your body. And so it's different for each person, but absolutely it escalates the process of therapy because of what it does to our brain and how it sort of turns off those pathways that have kept us stuck or kept us thinking the same thing or feeling the same thing or hiding the parts of us that need to come forward because we're really good at managing.
Yeah.
And
it sounds
sort
like you don't have to consciously be aware of what those things are because they're going to come up with the work anyways, right? Which is probably like one of the reasons you're already stuck because you don't really know what to fix, right?
Yeah. And I think it was Michael Pollan that said this on the Oprah podcast was the only other thing like this is meditation that can get you there. But meditation takes years of practice
and a daily commitment of a lot of time that most people do not want to put the effort into. So myself included.
Yeah.
I've tried, but I'm just like, I just can't do it.
Totally. I'm the same way.
And yeah, especially when like someone's already kind of like an anxious mind and anxious person, right? Like settling into that meditation is even harder for people like us to really kind of get there. So anything you can do to help get it there a little faster, I think is always a good way to support your body. So
yeah.
Awesome. So we have time for one more question. So if you met someone and they're kind of just like, hey, I'm getting started on my kind of healing journey, I want to start therapy, like what's kind of your recommendations on what they should kind of explore to find the right therapist? And if they are interested in psychedelic therapy, what's a good way to go about finding a practitioner that can be supportive for them?
Yeah, that's a great question. I would look into MAPS, which is the I can't remember the name, of psychedelics. And Psychedelic Somatic Institute is another one. Journey Clinical is the one I use for my medical provider. You can find therapists there. But I mean, if you really, what matters most is the therapeutic relationship and that you feel safe with the person. So I never jump into medicine sessions right away. We do start with talk therapy. We start with like building rapport, helping you feel safe, and then we go there. And that can take a month or that can take a couple months. So, but we usually work to build that first so that you feel completely safe and taken care of and trusting of the therapist.
Mm-hmm.
Yeah.
Okay, awesome. Amazing. And Chrissy, if people want to work with you or find you online, what's the best way to find you?
Yeah, you can find me through paradigmwellnesscollective.com. That's my group practice. I also have another personal website, ChrissyPowers.com, which you can contact me through there, find all of my emails through there. I'm on social media at Chrissy J. Powers. And so sometimes people find me through DMs and then I'm like, yeah, let's get to work. Like send me an email and consult call. And so,
awesome. Yeah. And where are you based out of? What city are you in?
I am in Oceanside. My office is in Encinitas, California. So
perfect.
I have an office and sometimes I do ketamine intensives in LA.
Okay, amazing. Yeah. Awesome. Well, thank you so much. We're going to go ahead and link to all your socials and links and websites in the show notes as well if people want to reach out to you. And I really appreciate you bringing light to this topic that not enough people are talking about. And I hope starts to get more attention in the next few years.
Yeah. Thank you so much. Thank you for
absolutely. Absolutely. Thank you so much.